Hello there. My name is Roger Harding. I am a dentist and essential oil expert, I guess. I've had a lot of people, dozens, if not hundreds of people, ask me over the years about incorporating essential oils with their dental practice and what it's all about. And I keep having these phone conversations with people or meet people in person to talk to them about it or give presentations or whatever. So I thought maybe it would be best to put this in a video and then I could send it to people. Then if they have questions afterwards, I'm happy to have them respond to me and send me questions. So if you have any questions during this presentation, write them down. I'll give you my email address at the end, and then you can reach out and have a communication, have a conversation then. Let me get into this. I prepared a short little presentation, so I'm going to share my screen with you and let you see. Like I said, I'm a dentist. I've been doing this for a long time, dentistry for a long time. I've been working with essential oils for over a decade now, and so I've had a lot of experiences using them in my office. But really today what I want to talk about is what is in it for you as far as essential oils go. And basically, I boil it down to three things. Why should you know about essential oils? Why should you know about this stuff? Well, the first reason is that your patients are using them. Whether you think they work or whether you think they're any good or not, your patients are using them, so it behooves you to understand about essential oils and what they're using them for, why they're using them. Second thing is they actually do work. Just over the last 10 years, 11 years, I've had too many experiences to say that they don't work, and the research, the evidence is there also. Third thing is that using essential oils will complement your practice, make you a better practitioner overall, and I firmly believe that. So let's get into this real quick. I'll tell you a story. I was going to dental school. This was at the University of Pacific, and again, like I said, it was a while ago, but it was recent enough where they were teaching us how to place implants. So we're placing implants, and I was fortunate enough to get a patient that needed one and would accept one. So we did the treatment, placed the implant. I think it was right up here around maybe over here, number 12 or 13, something like that. Put the implant in. It was great. Sutured over. Gave her a prescription for antibiotics, chlorhexidine, mouth rinse. Said, come back in a week. Let's check it out. So she comes back in a week. I said, okay, how are you doing? Let's take a look. Wow, everything's beautiful. It's healed over wonderfully. I must be an amazing surgeon. And so you must have rinsed with that chlorhexidine every day, right? No. So you must have taken that antibiotic, right? No. So she didn't do anything. I said, well, did you do anything? I mean, I thought I was a doctor and I'm supposed to tell you what to do, but obviously you didn't listen to what I said. She said, well, I was using essential oils. I just put a little tea tree oil or melaleuca oil on that every day, and I couldn't argue with the results. So that was the first experience that I had with it. And it kind of started me on that journey of, okay, you need to learn a little bit more about these things and find out what the deal is. Here's some statistics. 1990, there were about a third of the population were seeking alternative therapies. Fast forward 20 years to the year 2010, and you see that about 2/3 of the population are seeking alternative therapies. We're almost to 2020. Guarantee that number has significantly increased again. I don't have those statistics, but you can rest assured that that number is closer to probably 75, maybe 80% of people are seeking alternative therapies and using alternative therapies. Let's talk about essential oils. Why do I have a picture of the beautiful Oregon coast here? Well, it's to tell you that essential oils are different depending if they're grown at sea level versus grown at 10,000 feet above sea level. And I'll show you an example of this in a little bit. It depends. Essential oils are very delicate. They're made from plants, they're made from trees, they're made from bark, from flowers, different natural substances. And it depends what time of year you harvest these essential oils as to what kind of a yield you get and what kind of constituents or components are in the oil. It also depends what the weather is like during the growing season. A dry season can produce a totally different oil than a really wet season, and you may not even want that. And lastly, it depends on where in the world these things are grown, because different areas might produce a different chemical profile in the oil. Why do I tell you that? I tell you that because the quality and the purity of the oil matters significantly. And here's that example I was telling you about. This is thyme oil, and this is the main constituent in it. Um, and I'm not going to tell you each of these chemical names, but you can see the higher you get in elevation, you get a completely different main component, main molecule that's in that oil. And so it's going to behave differently depending on where it's grown. And so that's something you got to keep in mind. So it's not as easy as just pulling an oil off of a shelf and saying, hey, I know that we're going to talk a lot about peppermint oil. It's not enough to just say, I'm going to pull this peppermint oil off the shelf and let any of my patients use it, because it may not be as effective depending on all these different variables that we're talking about. Now, for years, gas chromatograph has been one of the primary ways of testing essential oils. Now, this is for a lavender oil sample, and you can see each of those little spikes is a different constituent, a different molecule that makes up this very complex oil, okay? Here's another test that is done, is the mass spectrometry. Mass spectrometry is important. It helps, along with the gas chromatograph, it helps to identify what's in the oil. It helps to identify if you have any chemicals or additives or whatever. But those are just two tests. Almost everyone does those two tests. There's a group called the Aromatic Plant Research Center. They say that the experts estimate that 80% of commercially available pure, and I say, quote, pure essential oils are adulterated in some way. And it's very, very difficult to identify the adulterated oil, okay? And you know, they've done some other research that says basically most companies have an oil that is adulterated. They only found one company that didn't have some adulteration in their oil, and that was doTERRA. And you'll see a lot of doTERRA products that I'm talking about, because I feel like they can completely be trusted, okay? So what are these oils being used for? And what are your patients doing with them? They're not only using them for their mouth, they're using them for lots of different reasons, okay? You can look at the list. You can pause the video, read the list, but just know your patients that are using essential oils are using them for many different organ systems in their body, and they're doing it with success. So number two, they work. Why do they work? Historically, you know, people have used oils, and you can read about different oils being used in the Bible and in many ancient texts. And so you get these back then, you know, as anecdotal evidence. People were using them, they had a good result, and so they'd use it again. Empirical observation. And what this has led to over time is more elucidation, and the basic sciences start to be built around that. And then that leads to research, and that leads to what we now have as a lot of evidence about the efficacy of essential oils in different organ systems. We're going to talk about the digestive system, specifically the mouth, and how essential oils are used there and how they can benefit and support your healthy oral environment. Okay, so yeah, let's move on. Here's one example how aspirin was developed. Aspirin, well, not aspirin, but this salicylic acid is derived from the bark of willow tree, okay? You distill the bark of a willow tree, one of the main things that you're gonna get out of it is this salicylic acid. Now what this company Bayer did is Bayer came along and said, hey, if we add this little acetyl group, right here, if we add this acetyl group to that salicylic acid, we'll get acetylsalicylic acid. We can pump that out synthetically, not organically. We can pump that out synthetically and make a killing, because the chemical, this salicylic acid is a strong pain reliever, and we get a lot of benefits from that. So let's do something where we can make this in our lab. We'll add this little acetyl group, and we can put it in a pill form, make us a lot of money. So that's what they did. They took this natural product that has these proven benefits, and they made it something that they could patent. Okay. Um, biofilms, they're our major enemy, right? Dentists hate biofilms. If we could get rid of biofilms, we might be able to get rid of dentistry. Probably not, but if we could get rid of them, that would be amazing, right? And biofilm, just simply, few bacteria start out here at number one, they multiply and they start to grow inside of this nasty, gunky paste, forms this plaque, those plaque colonies grow, and then finally, number 5 here, they get released and they go somewhere else and they start this new biofilm, right? So, biofilms are harmful for teeth, they're harmful for gums, and we're going to talk about how essential oils interact with those biofilms in a lot of different ways. Here's some clinical numbers that I have, and I have a lot of these, but I've taken a few of them out of this presentation just for sake of time. But this is a 40-ish-year-old male, and you can see where I highlighted in yellow, these are all the deeper periodontal pockets. You got 5s, you got some 6s over here, but all the yellows up here, those were all the really bad pocketed areas, okay? So this guy, this is in March of, let me make sure we're getting it right, March of 2011. You get all these numbers, and everywhere I've highlighted with yellow are the teeth that have some, either moderate or more severe periodontal disease around them. So 2 years later, so he got the cleaning, 2 years later, this is what he came up with. And you can see the yellow spots are again the places where we have deeper pockets, 5 still, but a significant difference in those 2 years. He didn't go for any kind of maintenance over that time. He didn't have any cleanings over that time. He only did one thing differently during that time. He incorporated a toothpaste that was full of essential oils, basically. And I'll tell you about that here in a second. So this is the text that he sent me. He said, "Oh, and my wife loves my breath and lots of kisses again." So this is another reason, not only healthy teeth, but healthy relationship with your wife. Okay. So evidence. What does the research have to say? Antimicrobial agents used in the control of periodontal disease are effective against, I got to put on my glasses, sorry, are effective against effective adjuncts to mechanical plaque control. So this basically says that essential oils, antimicrobial mouth rinses, and chlorhexidine mouth rinses, they can all be beneficial in, along with brushing and flossing. That's not anything special, okay? But let's look at this one. Antimicrobial effects of essential oils in combination with chlorhexidine. So here you got this line that I think is the most important. Cinnamon exhibited the greatest antimicrobial potency. They compared that with manuka oil. They compared it with tea tree oils. They compared it with thymol, which you find in thyme that we talked about earlier. And the combination effect of essential oil chlorhexidine was greater against biofilm cultures of both S. mutans and L. plantarum. Anyway, so cinnamon was better, and then cinnamon with chlorhexidine was also very good. So now let's look at another one here. Effects of prevention of dental biofilm formation. So here they're like, okay, what about preventing the formation of this biofilm? They compared peppermint oil, they compared rosemary oil, and they compared chlorhexidine against strep mutans and strep pyogenes. And what they found right here is that the peppermint was better than the rosemary, which was better than the chlorhexidine. So it's good evidence supporting the benefit of these essential oils. So from the research, again, we've got what works against biofilms and oral bacteria. Cinnamon, orange, clove, rosemary, eucalyptus, melaleuca, and peppermint at the formation. And if you look at what's contained in this blend of essential oils called On Guard, you've got orange, you've got clove, you've got cinnamon, eucalyptus, rosemary. And in this toothpaste that this guy used, doTERRA's also added peppermint oil. And, so it makes sense if peppermint is beneficial at preventing biofilm formation, if cinnamon is the best thing at killing the bacteria, and if these other products, the orange, the clove, the rosemary, are also beneficial at this stuff, it makes sense that this guy, after using this for a couple of years, had that significant of an improvement in his pocket depths. So when I'm thinking about myself, when I'm thinking about treating a patient with periodontal disease, this is a no-brainer to offer this to them, because I get better results without any of the side effects than I do with chlorhexidine, basically. There's a lot of research, a lot of documentation about antioxidants. If you take antioxidant supplements, that they can be very beneficial for patients with periodontal disease as well. doTERRA offers those, and I recommend those to patients as well. Now, how can this make you a better practitioner? We talked about periodontal disease, and we'll talk about that a little bit more, because I guess I personally feel like if there's one area that essential oils can benefit people, and it is with periodontal disease and gum health. And when you're talking about like prepping a crown, or you're doing a MO on number 3 or whatever, essential oils, you don't want essential oils around at that point, because they're going to interfere with the bonding and that kind of thing. And so they're best in a prevention model. I'll talk about some other things, but prevention is where they're going to be the best suited to help you. But how else can they help you in the dental office? So here's your dental office. What's like one of the first things that people think about? They think about the stress, they think about the anxiety caused by going to see the dentist, all right? So here's a little research that says that the ambient odors of orange and lavender reduce anxiety and improve the mood in a dental office. This is a no-brainer. You can do this. I had these diffusers running. I would let my assistants put different oils in at different times, and my patients would come and they'd say, I love it that this office does not smell like a, quote, dental office. It's nice to have that different smell. And patients really enjoyed that. Post-surgery applications, okay? Here's a little molecule. This molecule inhibits the inflammatory pathway at 4 different locations, okay? So if we could find something that would inhibit that inflammatory pathway, wouldn't that be nice after a surgery where there's going to be a lot of inflammation? So here I had to put a picture of the inflammatory cascade. This molecule goes in there. Where is it from? It's from this flower, a helichrysum flower. So this helichrysum oil is very beneficial. Frankincense oil is also great for anti-inflammatory. And I'll take a small little vial and I'll put a few drops, maybe 5 drops of helichrysum, 5 drops of frankincense, and I'll give it to patients after we place an implant or whatever, that they can just kind of rub on that surgical site, and the healing is great, amazing, beautiful, and I love the results. I'll also have them swish with some kind of a mouthwash with a couple drops of that On Guard that I was talking about, peppermint. I like tea tree oil or melaleuca oil for post-surgical applications, and just do a gentle rinse with that. It's great for keeping any infections down. Ginger and peppermint, what would that be for? Well, ginger and peppermint are great for patients that have nausea. So if you're doing some kind of sedation and your patients have nausea, I love to have ginger and peppermint around. All I'll do is just put a drop of ginger, a drop of peppermint in their hands, have them rub it together and inhale. And I had a patient that one time said, wait a minute, like it's gone. The nausea is gone instantly. I don't know how it works, but look, here's a study, aromatherapy as treatment for post-operative nausea, a randomized trial. It basically said that ginger is effective on its own. They also put together a combination of peppermint, spearmint and cardamom, and they compared that with just giving someone like saline water to smell. And the essential oil was much more effective than the saline. And I think they said the ginger was, the blend was most effective. Blend and ginger was, anyway, doesn't matter. The fact is, what matters is, you can read this, you can pause it, read it, but what matters is that it works, okay? And you can get a great benefit. It's cheap, a couple of drops of that in the mouth rather than, you know, getting a pill and having them take that for their nausea. Okay, so that's something I do. Xerostomach patients and periodontal patients, this is something new that just came out that I love. It's a mouthwash that I feel 100% confident in recommending this over chlorhexidine. It's alcohol-free, essential oils in it that we talked about before for the oral support, prevents and penetrates biofilm, and it helps balance pH with xylitol. So I recommend this for my dry mouth patients, just straight, and periodontal patients, and anyone after surgery to rinse with this just to keep prevent infection. Now, so I kind of went through all this stuff really quick. I'll tell you one other story. Okay, I had a patient. I placed an implant. It was like number 3 or 14. I don't remember which side exactly, but I placed the implant. Everything went well. Covered it over, and she came back and she had a little infection. You know, she had a little sinus tract there, and I was just sick. You know, that whatever happened, this thing got infected. And so I told her the different options. I said, we can try to clean this out, but I can't promise you anything. It usually, you know, that's usually not recommended. You know, we can take the implant out, let it heal, and then do it again. But I was worried because there was some bone loss, and if we did take it out, we'd probably have even more bone loss, and then there wouldn't be enough bone to place that. So we decided to open it up. I opened it up, and I cleaned around it with some essential oils, some of that On Guard oil, just to make sure that there was no infection left in there, because the evidence is so clear that that stuff gets rid of the bacteria. It's not a question. So I kept it really clean in there, irrigated it, cleaned it out, put some peppermint around there for its anti-biofilm properties. I got a little bit of bleeding going. I think I added a little bone, and, you know, sutured it, put a membrane over that area, sutured it up, and had her rinse with the On Guard rinse, and then have her put that helichrysum and frankincense on there every day. And it was amazing to see that thing healed great. The infection was gone. We restored the implant, and it was totally solid. The bone levels were good, and it was just another testament to me, or whatever, witness that this stuff is great. It prevents the things that it works against the things that we don't like. Okay, so why should you know about this stuff? First of all, your patients are using them. So if you know how they work, what they do, it's going to make you a better practitioner. You got to know that they do work. They are beneficial. They are helpful. And number 3, if you know how to use them, you can complement your practice and make you a better practitioner. I mean, I love being able to offer patients something that doesn't have side effects of like chlorhexidine, that sort of thing. So thanks for listening. Again, I'd be happy to answer any questions that you have. I'll give you my email address. It's, again, my name is Roger Harding, and email is just rhardingdds@gmail.com. So feel free to send me an email. Would love to talk with you, or just email with you. Whatever works for you guys. Thanks for taking the time to listen, and I hope you have a wonderful day. Goodbye.